Hi, my name is Sarah, and this is going to be my demonstration for NG tube insertion or nasogastric tube. So the first thing that you need to do is to verify the doctor's orders. You'll kind of just want to look at why he is ordering this or the purpose of the tube. What size, because depending on the purpose would be depending on the size. You may want to look at if the patient has the ability to swallow on their own, or if they have any allergies or any indications. So once you verified the doctor's orders, you can go ahead and start gathering all of the supplies that you need. You do need quite a bit of supplies to do this, so you just want to make sure you have everything in order to do the procedure in the patient's room. So next to me I have a table full of things, so I'll just show you. So here's my table. So I have my Salem sump, I have some tape, I have a pen light, some an alcohol pad, some gloves. These are just normal non-sterile gloves. I have an irrigation tray, I have a piston and syringe. I have, these are cotton tip applicators, but I'm just going to pretend it is my tongue depressor. I have some lubricating jelly, and I also have some hand sanitizer for hand hygiene, and I also have a cup and a straw, and this would have water in it. So I have all my supplies ready, so I'll just gather all my things and move to the patient's room. So I'd walk in, ensure patient privacy. So close the door, close the curtain, introduce myself. So hi, my name is Sarah. I'm going to be your nurse today and verify the patient using two identifiers. You never want to do the wrong thing on the wrong patient, especially this, because this can be kind of an uncomfortable procedure. So you'll verify their name and their birthday by checking their wristband or the chart to make sure it corresponds right. So after you've done that, you can kind of explain to the patient what's going to be happening. So like I said, it is uncomfortable, so you definitely want to let them know what can be expected. You also need to assess their ability to follow your directions. Even though it's very simple, they still need to be able to understand you. You also do need to assess their gag reflex. So you can do that by coughing or use that tongue depressor and to make them do the gag reflex to the back of the tongue. So once you've assessed their gag reflex and you explain everything that they can expect during the procedure, you can ask or answer any questions that they may have about, why they have to go through this, because they're probably already uncomfortable and this is going to make them uncomfortable too, but hopefully it'll make them less uncomfortable so their gastric contents can have somewhere to go, because they are probably having some kind of obstruction going on if this has to be ordered. So another thing we want to assess with our patient is their nares and their oral cavity. And you're just doing this to make sure that there's nothing in the way from the tube going past these things and down the throat and into the stomach. So you would take your pen light You would do all this after performing hand hygiene. So you would just take your pen light and you would, so let me do hand hygiene real quick. Alright, so we're just going to look at her nares in her oral cavity. This is my patient. So I would just look at her nares, make sure there's no irritation, no bleeding, no deviated septum. Just anything that could, kind of obstruct the way of the tubing. You could also have your patient occlude one nostril and breathe out the other one. That could also make sure that there's no obstruction, just one certain nare. You do that on both sides. And then inspect the oral cavity. So you would have them open their mouths and just, make sure, not that there should be, but just make sure there's nothing there to obstruct the pathway of the tube. So once you have explained the procedure, you've assessed your patient to make sure that no complications will arise to the best of your ability. So nare patency, oral cavity, patency. So now, once we've assessed our patient, we can go ahead and get our equipment ready. Okay, so let's go ahead and get our equipment ready. So first I'm going to measure our tubing, and how you do that is you measure so you'll measure from the nose to the ear. Okay, she doesn't really have an ear, and then down to the xiphoid process. She doesn't have a body either, so we'll just guess. So we'll just say that to this point right here is to the xiphoid process, and how you'll mark the area is by using tape. And this just kind of makes it easier, or lets you know when to stop inserting the tube because you've gone far enough. I just have some tape here, and then I'll just put it on my tube like so. So now we know when we get to this point we need to stop. And I'm also going to grab another piece of tape for when we're finished placing our tube, and we'll need to tape it secure to the nose or cheek or somewhere in that area. So you kind of just want to get a 4-inch piece, and you want to split it down the middle but not completely, so kind of 3/4 of the way. There we go, that looks good. Then we'll just put this on our table for use later. And then it's also important to note that you will need someone to help you during this procedure, because as you're inserting the tube, you're going to want a UAP or another nurse assisting you to put the cup of water and the straw up to their mouth, so as you insert, they're drinking water, which kind of makes it more comfortable a little bit, or just makes it like easier for the tube to be inserted. So it's important to note that you will need a assistant to help you during this procedure. It would be very hard to do on your own, so just make sure that you're prepared for that as well. So I have my tape ready to go. I have my tube measured. I need to inject 10 cc's of water into my tube. So there's little markings. You can't see that, but there's little markings on this tube. So you would want to put it in the water and suck up 10 cc's. And then you would put that in the tubing. And that just lubricates it a little bit. So we have our water in our tube. We have our tube marked. We have our tape ready. The last thing is that we need to do is to get our jelly and get that ready. So I have my jelly here, and then I would just put the whole thing. I just have this little paper here, and just put the whole packet of jelly on here, because you do need quite a bit of jelly. And again, it just makes it easier to insert the tube. But you do want to be generous with it. Alright, so now I have my jelly placed. We're all ready to start the procedure. So go ahead and get your patient in a comfortable position. So I'm tall, so I would lift the bed. Maybe put the side rail down that I'm working on, and put them in a semi-Fowler's position. Ask them if they have any last questions before we begin. If no questions, then I can go ahead and put on my gloves. And again, these aren't sterile, they're just normal gloves. So as we insert the tube, we're going to have him place their neck back, or their head back. And then once we start, inserting the tube deeper, we'll have them put their chin to their chest as they're swallowing water as we insert the tube, and hopefully we'll make it as quick and as painless as possible. Wait, now I have my gloves on. Alright. So we are just going to go ahead and begin. We'll let our patient know that we're going to begin, just so they can expect it. So I'll have my assistant with the water. And then I'll grab my tube. Alright, and then first I would have them lean their head back. So I'll have lean their head back a little, and then I would start inserting my tube. It doesn't really work when I actually try to insert it, so I'm just going to pretend. So I start first with their head back, and we're going to go in with the tubing. And then I would have my assistant put the water up to their mouth, and then I would instruct to swallow, and then as they're swallowing I would insert the tube more, and at this point they would need to have their chin to their chest, and this kind of directs the tube to where we want it to go, which is the stomach. So I would just keep having him to swallow, and as he's swallowing I would insert, and then swallow, insert, swallow, insert, and then I would do that all the way up until I get to this tape part. And if they are having trouble with gagging or coughing, you do just want to stop for a second, have them, kind of collect themselves, just stop for a moment because they just need a breather. As you're inserting the tube, you'll also want to use your pen light and just make sure that there's no tubing coiling at the back of their throat. So just have them say ah. Remind them to breathe through their mouth, not their nose, and just make sure that there's no coiling at the back of the pharynx. You can also do that with a tongue depressor too, but it just won't give you light, so that's why I like using the pen light more. So you have, and if you get resistance, just try to put a little bit more pressure, but not too much pressure because you don't want to force it. So once we have our tube down as much as we want it to go down, we can go ahead and tape it to the nose. So it would be like right here. And then I'll grab my tape. And then we'll just kind of wrap each piece of tape around the tube. That just helps it keep it in place. Okay, so now we have our tube placed. If there's any lax tubing, you'll want to secure it to their gown just so it's out of their way and they're not messing with it. And then this part right here will go to the wall to the suction device. But before we do that, we do need to make sure that we have placed our tube correctly in the right area, so on the stomach. And there's a couple ways that you can do that, but the only way to be sure is by doing a chest x-ray. That's the only way to be 100% sure. But the other ways that you could do is by putting this syringe in the blue applicator part, and you could inject air into it, and then immediately auscultate the epigastric region, and that would let you know that the air was put into the stomach, because it would make like a gurgling sound. Another way is, again, with the blue applicator, but you would take away the stomach contents, and then you would put that on a pH stick, and that could also let you know if the pH was the right value. Then you would know that's also in the stomach contents. So once you've kind of secured your device or your tubing to the face, make sure it's to the gown. If you are going to get an x-ray done, you want to make sure that the tubing is clamped to make sure that there's no contents getting out or on the patient, because that would make a mess. Also probably wouldn't make them feel very good. So you definitely want to do that when it's not applied to the wall. So usually right after this you would go to the x-ray department or have them come to the patient's room to do a chest x-ray to make sure it is in the correct area. So once you've done the procedure, you just need to make sure to clean up all of our equipment, and just do completion protocol. So just make sure the bed is to the lowest position, that the 2 side rails are up, make sure their call light is within reach, their personal items are within reach, and then once we're done with the procedure and the x-ray, we can go ahead and document what we did. So you'll just need to document when you place the tube, what the tube, like the size of the tube, when you placed it, how the patient tolerated the procedure, if any complications arose, like the coughing or the gagging. So once you're done with all that and documenting, you're done with this procedure. Thank you for watching. Bye. And the last thing that you could do to just make sure that the patient is comfortable, or just to help them, make them feel better, would be to do oral hygiene, since we kind of it would just help them feel a little bit better, since we kind of just invaded their space in that area. So you could have the UEP do it, or you could do it as well, but again, it just kind of can make them feel better after an uncomfortable procedure. Thank you.